Why can complications arise in appendicitis surgery? Appendectomy is a routine procedure, yet it's not without its potential pitfalls. We'll delve into these complications, their causes, and some relevant statistics. First, let's explore the possible complications of appendectomy surgery. Infection could occur at the incision site or within the abdomen. There's also the risk of bleeding, which could be excessive during or after surgery. An abscess, a collection of pus within the abdomen, might develop. Bowel obstruction is another possible complication, presenting as a blockage in the intestines. Adhesions, scar tissues causing organs to stick together, could form. Nearby organs such as the intestines or bladder could suffer injury. The abdominal wall might weaken, leading to a hernia. Lastly, there are risks associated with anesthesia, including adverse reactions or breathing problems. Now, let's move on to causes. The main instigator for an appendectomy is infection and inflammation of the appendix, known as appendicitis. Without treatment, an inflamed appendix can rupture, escalating into severe complications. Finally, we'll delve into some statistics. Appendicitis can strike both males and females, although some studies suggest a slightly higher vulnerability in males. It can occur at any age, but is most common in people between the age of 10 and 30. The condition does not discriminate by race or ethnicity and affects people worldwide, albeit with varying incidence rates across different populations. Bear in mind that the actual likelihood of these complications is subjective, varying from patient to patient. Factors such as the individual's overall health, the severity of the appendicitis, and the surgeon's skill level all play a part. Hence, it's crucial for patients to discuss potential risks and complications with their healthcare provider before undergoing an appendectomy. To recap, while appendectomy is generally a safe procedure, it's not without potential complications. These include infection, bleeding, abscess, bowel obstruction, adhesions, injury to surrounding organs, hernia, and anesthesia risks. The primary cause is appendicitis, and statistics show that it can affect anyone, regardless of sex, age, or ethnicity. However, the actual risk varies from person to person, emphasizing the importance of thorough consultation with healthcare providers before surgery. That's all for today's topic on appendectomy complications. If you found this video helpful and want to stay updated with more health-related content, don't forget to subscribe to our channel, hit the like button, and share this video with those who might find this information useful. Remember, knowledge is the first step towards maintaining and improving your health. Stay healthy, stay informed. We'll see you in the next video.